Alex, welcome back to the program. I understand Kamala Harris has just an amazing program for seniors. Tell us about this.
Yeah, Tom, I don't think it's possible to overstate how exciting this policy proposal is. Just this week, what Vice President Harris announced is a new home-based long-term care benefit as part of Medicare, the federal program Medicare, a Medicare at-home benefit. And this is just enormous. And I know you know, but just to set the scene a bit, currently there is no long-term care system in this country. We basically rely on families doing uncompensated care work, people caring for their aging parents and their children. And it's just...
Well, we do have for-profit nursing homes, but they tend to be kind of sketchy and they cost a fortune.
We do, exactly. And so rich people, you know, they can get care that they need, but many people don't need 24-hour care, right? They might only need a few hours a week with a skilled nurse, with someone who can help with taking some medicines or whatnot, but there's no system for that to happen. So basically it's sort of binary, like nothing or in a nursing home, institutionalized. And to qualify, to be able to pay for that, which often stretches into the six figures, we force people to rely on Medicaid, which is means tested, which means before getting the benefit, people need to spend down their assets. Sometimes they need to get a divorce so that in getting the care they need, they don't bankrupt their family. That's the system.
There's another gotcha in there, too. Tell me if this has changed. I mean, my dad died in 2006, and when he died, we discovered that Mom had Alzheimer's, and the two of them had basically been covering it up all those years. And she really needed care, and that Dad had been providing her. And they owned their own home, and they had a little bit of money in the bank. Dad had a pension. And we would have had to bankrupt Mom and then wait 2 years. You've got to be bankrupt or broke for basically 2 years before you can qualify for Medicaid, at least in Michigan at that time.
Yeah, 5 years is the planning period that, you know, we have to advise people. You have to start doing this in order to qualify for the benefit. And I mean, you know, Tom, you just said you've been through it, like millions of Americans. This process is dehumanizing, right? I mean, it's just, it's ridiculous that that's how we deal with long-term care in this country. And what Vice President Harris proposed is something that we've long wanted as part of Medicare, a universal program, not a means-tested one. Right. So a universally available benefit for at-home long-term care. And the best part, or I don't know, they're all fantastic parts, but another great thing is that to pay for it, all that we have to do is negotiate lower drug prices on more drugs, right? So seniors get lower drug prices. It saves the government money, which then is put into this new Medicare benefit. Tom,
but that means that the CEOs of the drug companies won't be able to buy third, fourth, fifth mansions in the Swiss mountains and, you know, a new 700-foot mega yacht. I mean, you know, don't you have any sympathy for these people, Alex?
My heart does bleed for the billionaires. This is one of those ones where literally everyone wins except the billionaires. And that's just something that I think the vast majority of Americans are willing to accept.
And that's why they're throwing money against John Tester right now. So this is a proposed legislation, I'm assuming. This is not something that the president could do on their own. It's going to require Democrats to hold both the House and Senate?
It will. And in that setup, it's probably, as you know, it would have to be something that's done through reconciliation, meaning with, you know, not a single Republican voted to give Medicare the ability to negotiate drug prices. We're not looking at a situation where Republicans are going to, you know, actually support this. So there is a path, but it does you need the Senate, you need the House, you need the White House. And even then, it'll probably have to be done through budget reconciliation, which has special rules. But that's the way to get through the filibuster in the Senate and not require 60 votes.
And can only last for 10 years. Although, once something's really popular after 10 years, it's a lot easier to keep it. And I would think that this would be very popular. So
I think that's exactly right, Tom. I think that's the strategy.
And I'm assuming people can read about this on one of your websites. You want to plug it?
Yeah, socialsecurityworks.org. You can find us on Twitter at SSWorks, and we have a lot of information about the new Medicare at Home, as well as just all the policies and the choices facing everybody in November. I mean, it's as stark as you can get. Donald Trump proposed cuts to Social Security and Medicare in every single one of his budgets. Kamala Harris just released a plan to add a new universal Medicare benefit, Medicare at Home. This is what the choice before us is. One path forward and one path back. So really, it isn't a choice at all. And you can find out more information at socialsecurityworks.org.
Now, one last question. When Lyndon Johnson and Robert Ball were passing, and Hubert Humphrey were getting Medicare passed, the white racist Southern senators made as a condition of passing Medicare that there had to be this 20% hole in it because they basically didn't want poor black people showing up in mostly white hospitals in the South. And they figured, with that 20% extra cost that that would keep them out of doctors' offices or whichever. And correct me if I'm wrong on that. And so will this require a Medigap policy, or is this going to be independent of Medigap? How's this going to work?
So it's a great question. I will say your setup is correct. And at the same time, Medicare desegregated the healthcare system. One federal policy that really did desegregate.
It was the most effective desegregation program in the history of America, actually.
Exactly. So, I mean, Medicare is an amazing program, and what we need to do when we design these new benefits for Medicare is we have to get rid of that 20%. We have to get rid of the need for a Medigap policy. So we think we need to level the playing field and add an out-of-pocket cap in traditional Medicare so that people wouldn't potentially face 20% of some enormous number. So we add the benefits, and to make that work, we include an out-of-pocket cap in traditional Medicare. And I think all of that could be done in a package that could move through reconciliation. But
is that part of Kamala Harris's, Vice President Harris's proposal?
No, and I think that's normal. The vision is laid out by, the campaign, the candidates, but the legislation is going to be done on the Hill. And so there's current conversations that it's going to sort of push forward on some pieces, like in Build Back Better, we had a long-term care policy, $400 billion, but it was built on Medicaid. So if we were returning, I think the starting point would have been that, but now it's going to be a universal Medicare benefit. But a lot of the other work that's being done on the Hill will continue, and this Medicare at Home policy would be part of it.
Yeah. Amazing stuff.
I should also, sorry, Tom, note, it also is vision and hearing. So it's Medicare at Home plus vision plus hearing. That's great.
Alex, thanks a lot for dropping by today and for speaking with us and for the just extraordinary work you're doing over there at socialsecurityworks.org and SSWorks on Twitter. Thank you so much.
Thanks, Tom.
Good talking to you, Alex. We'll be back with your calls here on Anything Goes Weekend. Stick around.